School of Public Health and welcome you to this admission information session. I'm Christian Tschudi. I'm the Director of Graduate Studies at the Yale School of Public Health. And joining me in this call is Melanie Elliott. Melanie, do you want to introduce yourself?
Hi, Melanie Elliott. You all got email from me about this, and if you have questions during the application process, be happy to help you. So just send me an email, and I would be the person you would, have a point of contact with if you were admitted.
Okay, also joining us are two current students, Hannah Ehrlich and Adam Vieira. Maybe you can introduce yourselves as well and maybe just briefly say why you chose Yale, why you decided to come to Yale. Hannah, you want to start?
Sure, yes. How's my sound?
Good.
Awesome. Hi, everyone. My name is Hannah. I'm a now fifth year PhD student in epidemiology of microbial diseases. That brings me to a small reason that I chose Yale, which was the fact that Yale separates its EPI program into infectious and chronic diseases. And with their infectious disease program, despite sort of separating it, they still take, a very interdisciplinary approach, which is part of the reason I chose to be here. A little bit about my research. I am in Sunil Parik's lab. I study the spread and surveillance of drug-resistant malaria in sub-Saharan Africa, and particularly in West Africa and Burkina Faso.
Adam?
Hi, everyone. My name is Adam Vieira. I am a fourth year PhD student in social behavioral sciences. Still weird to say that. My research focuses on developing and implementing harm reduction interventions to address substance use and all of its attendant health consequences. And I work with a number of different faculty, most notably Trace Kershaw, who's the department chair for social behavioral sciences. And one of the reasons that I came to Yale was just the amount of support that was given to PhD students, which wasn't something that I saw at other schools that I was looking at. So for me, especially as someone who had taken some time outside of the academy before returning for the PhD program, it was really important to make sure that I would have really strong mentorship and guidance and support across the board. And that's something that Yale has lived up to its name with. And so thank you and welcome.
Okay, great. So what we're going to do today is that I'm going to give a brief overview of the School of Public Health and the academic programs we have, like 15 minutes or so. And then we'll get into a question and answer session. And we start with answering the questions that you submitted when you registered. But during my talk, and afterwards, any questions that come up, put them in the chat and we will answer them as best as we can. And if not, myself or Melanie will get back to you with the answers. So let me share the screen with you and give you an overview, as I said, of our academic programs. So, as I said, I'm the Director of Graduate Studies of the School of Public Health, which means I oversee the MS, the Master of Science, and the PhD programs in the School of Public Health. They are housed in the School of Public Health, but these degrees are administered by the Yale Graduate School of Arts and Sciences. And I will go into more details, but we have different length and structures of these degree programs. Here I've listed some highlights of our school, and one I'm extremely proud of is that we're one of the top-rated PhD programs in the country. And our faculty ranked most productive of any US school of public health. And if you look at the history, the Yale School of Public Health is one of the first 8 accredited schools of public health. What is also an advantage to our students is an alumni network spanning all 50 states, Washington, D.C., Puerto Rico, and 69 countries. This is an enormous resource for our students. Our current dean is Stan Vermont. He is a global leader in AIDS research, still does active research, and he has been our dean for the past 3.5 years. But what the numbers are at the school, we have 550 students, and this number includes the Master of Public Health students, in addition to MS and PhD students. As you can see, we have 130 faculty, primary faculty, and this also tells you that the ratio of student to faculty is very favorable for the students. In other words, when you take classes, you will get to know your professor very well. And then there are about 160 staff and over 5,300 alumni, as I mentioned, all over the world. More information about the PhD and MS programs. Currently, we have 100 PhD students and 69 MS students. As you can see, mainly women. The average age in the PhD program is 27, so a bit older than in the MS program, which is 24. And we have quite a large number of international students and 13% of underrepresented minorities. These are the core disciplines in the School of Public Health. And these are basically the 6 departments that we have. And these are the 6 departments that confer a PhD degree. And 3 of these departments also have an MS program. And that's biostatistics, chronic disease epidemiology, and epidemiology of microbial diseases. The other 3, environmental health sciences, health policy and management, social and behavioral science, only have a PhD program. Here I've listed a few select cross-cutting disciplines, and I don't want to read through all of them, but I just want to highlight 2 that are very prominent at the school. That is climate change and health, and there is a Center for Climate Change and Health that started last year. And then we have an extremely strong mathematical modeling group that was assembled a couple of years ago, and I think I can say with confidence that this is one, probably the best modeling group in the country, if not in the world. If you think about coming to the School of Public Health, you should also think that you're actually coming to Yale Universities. So you will have a remarkable university at your disposal. There are over 10,000 students. It's not huge, but there's quite a number of students here. Over 160,000 living alumni, and the libraries are world famous that we have here at Yale. And we encourage our students, PhD and MS students, to take advantage of these rich opportunities through interdisciplinary studies. And a lot of faculty that you will interact with are not necessarily in the School of Public Health, but they could be in the law school or in the School of Management. And our students take advantage of this, that they can take classes in everywhere they want on campus. It's not restricted to the School of Public Health. And then not to forget that it's a beautiful campus with Gothic architecture. Not as great as Cambridge, but pretty close. And what I really find nice is there are lots of university galleries, museums, and forums with eminent speakers. And I would especially point out the Yale University Art Gallery, which has free admissions. And I often go there when I want to take a bit of rest from my work. And I just walk around for about an hour, and it's extremely relaxing. And I very often bump into students who do the same. One thing that we foster is women scientists at Yale as teachers and researchers. On the left, you see Dorothy Holstman, which broke gender barriers in the 1940s, and she was actually the first woman at YSPH to receive a tenure professorship. She worked on poliovirus. And also shown is Elizabeth Bradley on top right, who is now the president of Vassar. And at the bottom is Yasmin Salinas. She's a recent graduate from our program and is now an assistant professor in chronic disease epidemiology and one of our upcoming stars. What we also offer, which I also briefly mentioned, are excellent speakers that come to this School of Public Health. And since we're not a huge school, you will actually have the possibility to interact with these speakers. We always reserve time for students, and the students can interact and communicate with the speakers that we invite. And some of them I've listed here is the Dean of the Drexel School of Public Health on the very right, and the present US Surgeon General was here recently, the former commissioner of the FDA, and then on the very left is Sir Michael Marmot, is a renowned researcher in England. And we have many more speakers, but I just wanted to show a few of them. One thing that I'm particularly keen on is to provide excellent mentorship, and Adam already mentioned this when he introduced himself. And we as faculty, we take this very seriously, and I make sure that faculty are excellent mentors and really take care of their students and are involved in their academic education. And I take it very seriously, and I very often meet with students and mentor them through their academic lives. And what is shown here is Elizabeth Klaus. She is in the Department of Biostatistics, and she's actually an attending neurosurgeon at the Brigham Young Hospital in Boston and a full professor in biostatistics, and teaches 2 classes here at the school. So quite an active, and she's an excellent mentor. So what academic programs do we have at the School of Public Health? We have the main ones. The main 3 are the Master of Public Health. This is for individuals that seek a career in public health. So it gives you an overview of all the disciplines of public health. It's a 2-year program. Then we have the Master of Science in Public Health. And as I said, this is in biostatistics, chronic disease epidemiology, health informatics, or epidemiology of infectious diseases. And these are specialized education in a particular discipline. So to master skills, for instance, in biostatistics, it won't give you a broad overview of public health. And then we have the PhD in public health, which is the classical PhD, which provides scholars with a disciplinary background and skills required to contribute to the development of our understanding of better ways to measure, maintain, and improve public health. So you might wonder what are some of the career outcomes when you would choose one of these academic programs. On the left, you see the MS career outcomes. At the bottom is for biostatistics. And most of the graduates will go into business, industry, or into financial institutions. And quite a few go to Facebook and Google. The second most outcome is further education, which generally means obtaining a PhD. Another example is for CD, where most of the graduates go into academia or further education. And PH career outcomes are shown on the right. And as you can see, most of them go into further study, or they go into the government or public health sector. What about PhDs? It looks very different, as you can see. and that the vast majority of our PhD graduates go into academia as either as research or as faculty. And then others go into government and public health sector, or business, industry, and financial institutions. But the majority will go into academia. A little bit more about the Master of Science program. We have a program in biostatistics. It's a 2-year program. There are 2 pathways, the standard pathway, which is biostatistics, and then there's an implementation prevention science methods pathway. Chronic disease epidemiology has a 1-year program that you can also take part-time if you wish. Health informatics has a 2-year program, and epidemiology of infectious diseases has a 1-year program that can also be taken part-time. So for the PhD in public health, as I said, we have 6 departments that have a PhD program, and these are sometimes also referred to as tracks. So when you apply, you would apply to public health program, but then choose a track, which would be one of these 6 departments. And I'm very proud to say that the program has close to 100% completion rate, and we have one of the highest yields among US schools of public health, with 71% of admitted students matriculating. More practical, so we guarantee full stipend, tuition, and health insurance for 5 years. At the same time, we encourage our students to apply for external funding. And in the first year, you would do coursework. In the second year, coursework, teaching, and the qualifying exam. And by the end of the 3rd year, you are expected to submit your dissertation prospectus, which is an outline of your dissertation work. And then the final milestone is dissertation research and defense. And the average time to graduation in our program is 4.8 years. A couple of words about the admissions process and what we look for. And I highlighted for the PhD, I highlighted the personal statement, which is the most important part of your application, where you should highlight research accomplishments, future goals, and most importantly, how these interface with the PhD program and Advise PH. In other words, where do you fit? What faculty would you be interested in working with? That's all you have. We have to tell you this in your personal statement, because there's no other place in the application where you can let us know. So the main thing we're looking for in applicants is whether there is a fit with our program and with our faculty. If we don't see that, we don't see much point you coming to Yale. So you really have to tell us why you want to come, who you want to work with, what your interests are. Strong letters are important, and get them from people that can tell us something about yourself. So a teacher that you took a class with probably can't tell us much, because we can see from the grades how you did. But we would like to have letters that tell us more about you. We still require GREs, but we don't look at them very carefully. This is not a criteria for admissions. Similarly for the MS, that strong letters of recommendations, and all 4 of the MS programs require strong quantitative skills. How to apply? So for both the MS and the PhD, you apply through the Graduate School of Arts and Sciences, because as I said at the beginning, it's the grad school that administers these programs. And I've just listed here what you need to provide is transcripts, at least 3 letters of recommendation, general GRE scores. If they're not available yet, that's fine as well. TOEFL or IELTS if English is not the primary language, and if you did not or if you have not been educated at an institution where English is the primary language. I would say a CV is optional, but I encourage you to put it in because again, it can give us more information to find out who you are. And we do not require a writing sample. And the deadline for application every year is December 15th. Okay. So I see there's already some questions in the chat, but let's start with the questions you submitted when you registered. Why did the EPI students choose these specific departments, and is it possible to work between departments? Hannah and Adam, do you want to take a crack at this?
Sure, yeah, I'll start. Chris, the question was about EPI students in particular?
Yeah, I would say these specific departments, I guess, EMD and CDE. I think
Okay.
That's the way I would interpret this, yeah.
Sure, yeah. So I'll start by saying one of the most important reasons I chose EMD over other EPI programs was the fact that this program requires research rotations, which was important to me because I wasn't exactly sure who I wanted to work with at Yale, but also because it gives you an opportunity to sort of, even if you think you know what you want to do, to just explore a little bit more. And so, for example, in my rotations, I rotated with the Connecticut Agricultural Experiment Station, which is outside of Yale, but within New Haven, to do some arboviral transmission work. And I also rotated within the mathematical modeling unit, which, as Chris said, is a very strong and supportive community, even for people who didn't come in with very strong computational or math skills like myself. And yeah, maybe I'll leave it at that. Adam, do you have anything to add?
I don't know that I have anything to add. I think you gave a pretty comprehensive answer.
Okay. What is the deadline for receiving PhD application on a yearly basis, specifically for 2021? When do the applications open? The applications open in August, and the deadline is always December 15th. And next year, we're probably going to have a change in the requirement or not requirement for GREs. So that's, I think several of the departments are going to drop the requirement for GREs. What global international opportunities are available? Hannah, do you want to take a crack at this?
Sure, yeah. Yeah.
Since you work abroad.
Sure, yeah. You know, this university is well suited for finding funding. There are lots of opportunities to go abroad. Most students at the School of Public Health go through sort of 2 or 3 different channels. The first is a co-fellowship between the School of Medicine and the School of Public Health called the Downs Fellowship. You apply for it between your first and second year for funding to go somewhere, usually in the first summer after you arrive. Then there are small and also very large dissertation grants that are offered through the Macmillan Center, which is a sort of collection of regional centers that focus on that supply funding for work across the humanities, social sciences, and natural sciences abroad. And then also, if you choose to work with an advisor who has projects that are going on outside of the United States, then that's also, of course, a good way to get funding to go. But yeah, there are so many opportunities. That's definitely a plus of being here.
Yes, and I can add to this that there are multiple faculty training grants that we have in EMD, providing opportunities in South America, Africa, Asia, in Europe, so multiple opportunities. Let's see. So there was another, I'm interested in global health. Is this the right program for me? Absolutely. how big is the entrant cohort size? That varies every year. Can be between 15 and 30. And I'm talking about PhD students only. MS students is increasing every year. Last year we admitted 70, but due to COVID-19, only about half of them are actually starting. The others have deferred. And you might think this is a really small cohort entering, but it's all restricted because, as I told you, we provide funding for 5 years. So if we admit a student, we have to have funding available, and that's what restricts us. We can't admit more because we don't have funds available. I have an MFA, but many years professional experience in harm reduction. Would I be a good fit for your program, or are you mostly interested in people with a science background? Adam?
Yeah, no, I absolutely can say that you would be a fantastic addition to the PhD program. As someone who had 15 years of professional experience before coming to the program and didn't have a lot of research experience prior to joining, I've received a lot of support. And so I think that it's just important for you to recognize that you're going to need sort of different support than what the university traditionally offers students, but that support is here. It's just important to know that you'll need to kind of go a separate path just because your needs are going to be different from the needs of other students who might have more research experience. But I know that I've been able to find success here with a background in both harm reduction and not a lot of science. So feel free to talk to me more if you want.
Does Yale offer MD, PhD in public health? We don't have an MD, PhD program at the School of Public Health, but the School of Medicine has a very successful MD, PhD program. And I'm actually part of the admissions committee of that. And currently we have 7 or 8 MD, PhD students at the School of Public Health. So you would do the first 2 years, you would do clinical work and take classes at the medical school. And once you decide on a PhD, you can choose the School of Public Health to do your PhD for the MD, PhD program. And you can choose any of the 6 departments to do your PhD in. And currently we have PhD students in CD, EMD, and biostats. Do you have any long distance executive doctorate program at the School of Public Health? No, we don't. Okay, I think that's all. Let me just check. What is usually the approximate admission rate to public health program for international students? Is there a first come, first serve rule? There's certainly no first come, first serve rule. I wouldn't even know how to do that. As I mentioned, we are looking for a fit that you have with our program. Admission rate. As I mentioned at the beginning, we are a top-ranked PhD program in the country, so admission is very, very competitive. In the last round, we got over 400 applications for the 6 tracks in the PhD program, and we admitted 22 students. So you can imagine that it's very competitive. And I mentioned this. I've seen this a couple of times, a minimum required score for TOEFL. We don't really have that. The graduate school has that because they oversee the admission process and they want to see a total score of 100 or better. But we have admitted students with a lower score. And what we do in those cases is that we interview them, either bring them to campus, and we do have, obviously not this season around, we generally have a recruitment day where we bring all the applicants we are considering to campus so they can get us to know us and we get to know them. And there it becomes very clear whether the TOEFL score is an accurate reflection of the English or not, or otherwise we just do Zoom interviews. And generally the TOEFL score, I realized in the past, is not a good measure of English language proficiency. And we can convince the graduate school, that if we did all this, that the TOEFL score below 100 is fine. When should we expect to hear back after we've applied? And now going to the chat. So application deadline, as I said, is December 15th. We generally review the applications over the Christmas break and try to make decisions by mid of January, because our recruitment day, which next in February will be virtual, is generally in the beginning of February. So we need to make our decisions very quickly. So you will hear from us quickly.
I answered a few, but you can.
Yes, I wasn't at the top. How are previous work experience and research experience considered for admission? If they are relevant to what you want to study, absolutely, they are very important. And most of our students that we admit have previous experience in research or work. And that also explains why the average age in the PhD cohort is higher than in the MS program. But again, it's the whole package that we look at. We don't look at one particular aspect. It's the personal statements, the experience, and then most important, the fit. Is there a fit, and are you telling us why you want to come here and what you can do here? If I do postgraduate study in the UK, do I need to submit TOEFL? No.
So the rule is only undergraduate degrees taught in English allow for TOEFL or IELTS waiver. So if it's postgraduate, okay, I don't think that will qualify.
Okay, didn't know that, you see, even after so many years, it didn't. I talked about the score of the TOEFL and Melanie answered. Do I have to identify a certain professor and contact them to ensure that my research goal matches theirs before submitting the application? You don't have to, but I highly recommend it. Because also, as you probably know, websites are generally not up to date. So it's better to get in contact with a professor that you're interested in maybe working with. It's not a requirement, but I highly suggest it. That way they also get to know you. They know you're interested in our program and in their work. And it's possible that that faculty might then be on the admissions committee. So has some inside information. And just to extend a little bit on that, when you look at our program and any program, I recommend that you identify 3 to 4 faculty that you might be interested in working with, not just one. Because by the time you will start your research, which is like 3 years after you apply, that one particular faculty might not be there anymore, might not be here anymore. So 3 to 4, if you can't find 3 to 4 faculty at our school or any other school, I wouldn't recommend you applying to that school. Just too narrow of a focus, and you will not like it, you will not enjoy it. I imagine. Do the GREs have to be taken within a certain number of years, taken in the last 5 years? That is correct. Is there a GRE waiver procedure?
No. There's no, none that I know of. This year, though, who knows?
Never had it, yes. Do I have to specify in the personal statement the exact research question I'll be working on in the PhD dissertation? That would be asking a lot. Some students, incoming students, do know what they want to work on. Others, they know vaguely what they want to work on. So either way, but more importantly, you should let us know what your interests are. Even if they're general interests and you still need to formulate your precise research interests, you need to let us know what your general interests are. I would find it surprising if you could tell us precisely what your dissertation work is going to be, but some students know, but the majority don't. How many first author publications can students expect to have by the time they graduate? Are students admitted primarily as a cohort or based on having a potential mentor? Any of the students want to answer the first question?
Yeah, I'll start. I don't think that there's any hard and fast rules. Probably some trends. I would say that while publishing is very important in the sciences in general and social sciences, it's not the most important thing at YSPH. So I would say that professors and faculty and staff encourage you to work on like multiple projects at once based on your interests. With the COVID pandemic, there's so much other research going on that's taken us away from our own dissertation research, but it's still important, some of which might get published, some of which might not. And so I think that you'll find if you come here that there are a lot of opportunities like that. And it's sort of like a do with it what you will. It depends on who your mentor is. But yeah, I don't know. And if I had to say some number, it would be, I think 3 or more, right? Because the idea is that your dissertation should have like at least a handful, so at least 2 to 3 publishable works by the time you graduate. I don't know if that's an official rule. I see.
Yes, no,
Okay.
we all know how research goes. Sometimes it goes great, other times it's not so great. So the rules we have for what the outcome should be at the end are written very vaguely, and that's the way I like it. And as Hannah said, should have, it doesn't say anywhere must have 3 publications, must have all first author publication. It doesn't say must be published by the time you graduate. It all says should be. Because sometimes the work
Sorry, I was just going to say there have been students that leave the program with many, many publications. Shout out to Joe Lunard, who is a modeler. Yeah. It also depends, of course, whether you're doing secondary, primary data analysis, whether you're collecting your own data, things like that.
Yes. You want to add anything, Adam? Or?
No, I mean, I think that Hannah really covered most of what I would say. I think the only thing I would add is that I think it also depends on what your professional trajectory is and your goals for after you graduate. So for folks who are considering jobs in the academy, I think that it's really important to have published manuscripts and articles out there. But for folks who are looking at other career trajectories, it becomes less important. And so you might choose to focus your energy elsewhere. And that's something that I think you can kind of decide jointly with your mentorship team to make sure that you're not just turning out manuscripts because it's expected of you, but because it furthers your academic goals.
Okay. Does applying early increase likelihood of our acceptance? Not at all. As I said, deadline is December 15th, and then the admissions committees, which we have admissions committee for each department, over the break, they start looking at applications, and sometimes, not sometimes, often late applications come in during the break, and they are considered the same weight as the others. You know, there's no timeline involved. So for funding opportunities, are there any differences between international students and US citizens permanent residents? Unfortunately, yes. In that, so for funding opportunities, what we have available are training grants from the National Institute of Health. And these slots on these training grants are restricted to US citizens and permanent residents. So not eligible for international applicants. So for international applicants, what we have is ISPH fellowships. These are given to us by the Dean Sten Vermont. And these are no citizenship requirements for those fellowships. So that's where we can fund international students. Other sources, you know, that we have students that come with their own fellowship, with a Ford Fellowship or a Canadian Fellowship, a Gates Fellowship. So that's something else, you know. As I said, we can only admit you if we have funding for you. Either we provide the funding or you come in with your own funding. If you are looking for own funding, we don't need to have that by December 15th. You know, you can simply state in your application that you have applied to this and this foundation. And if we are considering you for admission, we will contact you and ask you where that application stands and whether you have heard anything. Research internships in non-profit or private sector settings that is not in a lab considered significant enough? Or does a student absolutely have to have academic research? I don't consider them differently at all. Any research experience counts. I mean, if you do, for instance, an internship or work in a public health department, it's not academic, but it's a great experience. Or if you work at the CDC, you know, that's, so no, there's no difference. We don't look at this differently. It's the actual experience that you have and is important, not where it is. Because that would mean we would look at somebody who has experience at WHO, you know, differently than somebody that goes to university. So I don't think that would be fair. I would like to ask for advice regarding the best way to contact the professors prior to the application. I would suppose via email. Yes, absolutely. And don't be shy. Generally, our faculty is very responsive to inquiries about prospective students. I would recommend that the first email, you keep it relatively short. You know, say that you're interested in the program and in their work. And you can attach your CV. But don't write a huge long email, and just ask whether you could get to know more about their research, and even if they would have time to meet with you. But absolutely, yeah, I encourage you to contact professors you're interested in working with. And you can find the email addresses, as Melanie wrote, on the public health website with all the faculty listed. Do you provide grant writing training? Absolutely. Have any of Adam or Anna, have you done any of that?
Yeah, so I know that there's a class that you can take that's offered at the School of Public Health on grant writing. I placed out of it because the T32 training grant that I was accepted under also offered grant writing. So that was really useful for when I was applying for my F grant. In addition, as I think Melanie stated, the graduate school offers training and support services, including peer review for folks who are writing grants on a variety of topics. It doesn't have to be specifically like an NIH research grant, although there's specific workshops for that. So there's, I think, a lot of support that's out there, both in terms of formal workshops and peer review and peer support.
Anna, no? Something to add? Okay. When you mentioned to include several faculties in the application, does it mean, for example, health policy and management and epidemiology? Wouldn't mentioning 4 faculties make the statement look too general? It would be faculty that you're interested potentially working with. So not just random faculty here and there. And that's, unfortunately, we get that as well in applications, and then it's rather difficult to figure out what are your main interests if the faculty is all over the place. So that I wouldn't recommend. That doesn't look good. So if there are only 2 or 3, mention 2 or 3, but don't add a faculty from another department just for the sake of it. That's not helpful. It actually does more harm than it does good. Is COVID impact cohort sizes and funding this application cycle? Honestly, I do not know yet, because I have not had discussions with Dean Vermund about the upcoming admission cycle and what funds are available. I normally do this in December, but actually this year I'm doing it in November, a little earlier, to get a better idea what's going to happen. So honestly, I can't say. Would someone who's interested in chronic harms and polypharmacy and substance abuse in HIV be better suited for the chronic disease epi or the SBS? I've identified faculty in both disciplines that I would like to work with. Adam, you want to comment on that?
Yeah, absolutely. So I think that confusion is entirely warranted, given that SBS actually started out as a track under chronic disease epidemiology. So I think what you're experiencing is some of the connection between those 2 departments. I myself have mentors in different departments, as well as mentors who are outside of the school and the School of Medicine. So as Chris mentioned, I think the interdisciplinary focus on public health that Yale offers is really embodied in a lot of different ways. And one of those is in terms of how you choose mentors and different people to collaborate with. So I think that you would probably want to choose your department based on the structure that department offers, but you can definitely have mentors and supporters from outside of the department. So don't feel like that limits you in any way.
Yeah, I agree. Can students work with faculty between disciplines or even faculty in other schools? I think I addressed this a little bit in my presentation, and I say absolutely. It's encouraged, highly encouraged, because we have 130 faculty at the School of Public Health, but we can't cover everything with these 130 faculty. So for your dissertation work, you need expertise that is outside the school, either in any school at the university, and even outside of the university, if that doesn't exist. And I think Hannah is one of those. So I have no problem with that. You know, whatever it takes to help you to achieve an excellent dissertation. And if you need help from outside the university, dissertation advisory members can be from outside. I have no problem with that. Can students switch between disciplines after matriculation? I'm not sure I completely understand this question. Does this mean switching the initial advisor or
from chronic disease epi to epi of microbial diseases?
it happens very rarely, as happened. So we're not against it, you know, if we realize that the initial choosing was not appropriate. Certainly happens extremely rarely, because again, we look at the applicants very carefully, you know, and then especially on recruitment day during the interviews, you know, we'll find out what is the match or not, you know. And so for PhD and MS students, when you're admitted and you accept to come during the summer, we'll assign you an academic advisor. And that's somebody who we think matches your interests. That academic advisor for PhD students can turn into the dissertation advisor, but it's not always the case, because you might shift your interests, your research interests slightly and choose a different advisor. That can certainly be done. Is it okay to apply to two different schools like YSPH and then other if a student is considering two very similar disciplines? Is this a school at Yale or another school in the country? At Yale, you can only apply to one program, to one PhD program. You can apply to the PhD program and the MPH program at the same time, but you cannot apply to two PhD programs at Yale. Is there a preference for primary or secondary sources research, and also for qualitative or versus quantitative? Adam or Hannah? Adam?
I mean, I would say no. I mean, I think that I know PhD students who are pursuing all of those different types of research and using all variety of sources. So I think it really just depends on what your research question is and what would be the most suitable way to answer that question.
Okay. I'm interested in community-based intervention research for nutritional related illness. I've read about CARE at Yale and would like to know more. Can anyone share their experience with CARE? Hannah or Adam? I don't have any experience with CARE, I'm afraid.
Kathleen Dufani is the best contact, and she is actually a graduate of our program, and she is listed on the faculty pages under social and behavioral sciences.
I also see that there's a couple of MPH students, current and former MPH students who are on. So if any of them have experience with CARE, it might be nice for them to share that.
Mm-hmm. Just unmute yourself and if you want to.
I haven't worked directly with CARE, but I have worked with Dr. Duffany, and she is a wonderful professor, a wonderful mentor. She really makes sure that you understand what's going on. So yeah.
So I think I'm at the end of the questions in the chat. We're just about reaching an hour. Just to close out, I mean, please do not hesitate to contact any of us four, and the fifth person will be Stacy Bonet, who's also working with Melanie and myself. Any questions you have about the application process, faculty you're interested in working with, documents you have to submit, the questions about those, do not hesitate to contact us so we can help you and guide you through this process. Melanie, anything to add at the end?
No, just feel free to contact us. I'm putting our email addresses in the chat, and we are very responsive, and we'll get back to you. I see one student said she has emailed Dr. Dufani, but she hasn't gotten any response. Alanis, I will, thank you, Adam. I will get back to you on that, Alanis, because there may be another faculty member who can talk to you about the CARE program. And Hannah and Adam have shared their emails.
Okay, great.
The other thing is to also know that the students, a lot of students have profiles on the Yale School of Public Health page and have email addresses and a little bio on their research. And part of them signing up to do that means they are likely going to get questions from applicants. So feel free to go on those sites. They're divided up by each department. And if you see a student that you're interested in chatting with, send them an email.
Oh, let me just answer one last question. Does Biostatistics Group work closely with the Statistics and Data Science Department? Absolutely. And if you go into the Biostats program, MS or PhD, a lot of your required classes are actually going to be in statistics and data science. Okay, there are no further questions or comments. Thank you all for attending, and I really hope that this was helpful. And I wish you all the best and stay well and safe. Bye-bye.
Everyone.